So right now I am ready to go. I want you to be extra cautious. Make sure that you don't stick yourself. If you should stick yourself, God forbid it happens, but it does. If you should stick yourself, immediately stop, set the syringe down. I want you to give the puncture site a squeeze, get a little bit of blood out. Then I want you to go inside, wash your hands with soap and water, contact your physician, go to the emergency room, whatever you need to do to make sure that a medical professional knows that you've been stuck with a needle. It's very important for you to let someone know. You don't want to take the chance of getting an infection. You don't want to take the chance of picking anything up. So my needle is ready. Jocelyn has the baby in position. I'm going to grab the skin and I'm going to inject just underneath the skin. Little poke right underneath the skin. The skin is tough. Baby didn't like that, but that's it. So that it's been injected into the animal is fine. That was a sub-Q. It's just going underneath the skin. You do not want to go in the muscle. That would be an IM shot, and that's something that we'll cover at another time. But just underneath the skin. If you're feeling a lot of resistance, like you're getting into the rib cage or you're getting in a muscle, you need to stop, pull the needle back, and start over. Make sure that you dispose of all needles in appropriate containers. You can contact your local veterinarian. They should have sharps containers, or you can also contact the public health office in your town and they would give you information as to where to dispose of needles correctly. You don't want to throw needles just in the trash can. You're setting yourself up for someone to accidentally get stuck. All right, so we've given our tetanus antitoxin injection. The next thing we're going to do is move on to ear tagging. Again, least invasive to most invasive. It's probably a toss-up as to what's going to be more upsetting to the animal, the ear tagging or the tail docking, but in this case I'm actually going to cut the tail, so I'm going to tag the ear before I do that. So again, you have a male and female end of the tag. You want to make sure that your tag numbers match up and double check those before you actually put the tag on. In this case I have 767980, 767980. Trust me when I say this, you don't want to tag the ear and then find out that the numbers don't match after you're done. So I'm going to load the ear tagger. Female end goes there, male end slips over this, and I am ready to go. Again, you can buy all these supplies and you can buy ear tags through multiple online sites. We tend to use Premier. Now if you look at the lamb's ears, on the inside of a lamb's ear there are little veins of cartilage that run out. That helps to give the ear structure and it helps to hold the ear up. It may be difficult to see from there, but I assure you that you can feel them. There's about 3 veins that run up the ear. They're not true veins, but they're veins of cartilage. So it's going to feel like a bony structure inside of the ear. The ear tag needs to be placed between these veins of cartilage. You don't want to hit one of these veins of cartilage when you're putting the ear tag in. It's going to cause excess pain to the animal and it can damage the ear structure to where the ear doesn't sit out correctly. Now when you tag the animal, you want to make sure that you think ahead. Now her ears are this big right now, but when she gets older she's going to have full-size ears, and we don't want to put the tag way out here. If you put the tag way out here, it's going to be dangling down like an earring. It's going to look goofy and you're going to be very unhappy with it. So you want to get as close in as you can comfortably get. We're not going way inside the ear. We're not going out here. We're going right here as close as we can get to the animal without getting up inside the ear. I tend to put my tags between the first and second vein of cartilage. So right about here where my finger is. I tag my girls and boys on different sides. That way I can tell at a quick glance if it's a girl or if it's a boy, depending on which side the tag's on. That's completely up to you. In this case, because this is a female, I am going to tag her on her right side. If it was a boy, I would be tagging them on their left side. So on the right side of the lamb, I'm going to take a look, get an idea as to where I want the tag to go, look, make sure everything's okay, and then we're going to move forward from there. Now, I personally do not clean off the ear itself unless it's excessively soiled. I found that the easiest way to do this is to actually spray the antiseptic directly onto the male end of the tag instead of spraying it onto the lamb's ear. The reason for that is if you tend to want to spray on the animal, you're taking a chance of getting any spray in their eye. You're also taking a chance of getting some of that spray down in the ear, and that's something that we want to avoid. I use this wound coat. It's purple spray. You can pick this up at, again, any supply house. I think you can get this at Tractor Supply. It's $5 or $6. So what I'm going to do is I'm going to spray this away from me. You don't want to get it on yourself or it'll never come off. And I'm actually going to saturate the male end of this tag. Make sure that you get it completely covered. You want to spray away from the tool. That way you're not getting this purple stuff all over the tool. I'm going to line up the male end with the point on the lamb's ear where I want to go. Once you start tagging this animal, you are vested. Once you start squeezing, the animal is going to jump. The animal is going to fight. You need to make sure that you squeeze hard and you squeeze fast. This gets all the way through. It gets seated appropriately. Don't give them a little squeeze and then chicken out and stop. You're going to cause more damage to the animal, and you take a chance on causing a partial perforation, and it's just going to be a mess. So get it lined up, quick, fast, push it through, and be done with the process. I've got it lined up. I'm sure that I'm not hitting the cartilage. I'm ready to squeeze, and see, she just felt a little pinch there. And that's it. It's done. Okay. So the tag is in. As you can see, she felt a little discomfort there initially, but now she's perfectly fine. So that's that. She's good to go. Everything looks good. It's seated correctly. We're good to go.